Personal protective equipment, including face masks and gowns, still in high demand around the world, which is making getting enough medical supplies into our country a challenge. Now, the federal government has created a COVID-19 supply council. They will tackle the issue, and the Minister of Public Services and Procurement, Anita Anand, is part of that council. She is back with us again on Your Morning. Welcome back.
Hello, thanks for having me again.
Nice to have you here. All right, in the announcement of the Supply Council, they spoke about logistical challenges. Last month, we saw 2 planes return from China, both of those empty. China, of course, is where most of the world's supply of PPE comes from. What other logistical challenges can we anticipate?
First and foremost, we have to remember that we are operating in a period of high global demand for the same product. And so we have multiple countries, multiple jurisdictions competing for the same products, face shields, masks, and gowns in international markets. And so our responsibility and our goal has been to set up a logistics system on the ground in China so that we can ensure that we are following our goods from start to finish, from the manufacturer right through to the airport, through the bureaucratic channels, back here to Canada. Our embassy in China, led by Dominic Barton, the ambassador, has been incredibly helpful in this process. And we have actually had over 20 flights coming back to Canada filled with PPE for distribution to frontline healthcare workers. So the process is difficult, it's complex, but it is manageable, and we are working very hard day and night to make sure that procurement occurs like it's never occurred before for the purposes of addressing and responding to this pandemic.
What's your response to medical professionals who say they are still struggling to access adequate PPE?
This is a collaborative process that we are engaging with the provinces and territories. The Public Health Agency of Canada has provided the provincial requests for PPE to us, and the federal government then goes out and procures goods. And we are buying in bulk for the provinces and territories. Once they're back to Canada and they are inspected and up to the standards that must be met, then the provinces distribute them to frontline healthcare workers. It's an ongoing process that we are encouraging everyone around the table to work as efficiently and effectively as possible.
And of course, we can appreciate these are unprecedented times. Some provinces, however, are starting to reopen, as you know, which means hospitals are starting to reopen, clinics are starting to reopen. Are there enough medical supplies right now if a second wave of cases were to hit, or even for the reopening of various healthcare facilities?
Such a great question. There is the need to plan for the short and the long term. The federal government is still purchasing in bulk for frontline healthcare workers because that's the priority, making sure that Canadians and frontline healthcare workers are safe. Beyond that, as you mentioned, there is a need to think about the opening up of the economy and whether there is enough PPE. And I wanted to mention that hospitals and businesses and provincial and territorial governments across the country are also purchasing PPE. So this is a team effort. We are all working towards making sure that as we go back to work, as we roll out through the next phases of this crisis, that we have the personal protective equipment that Canadians need.
I know that we're all working hard to purchase it, but like everybody who's purchasing online right now, waiting for the delivery is the timepiece that becomes so crucial. Minister, I want to thank you for being with us again on Your Morning.
Love being here. Can't wait to the next time. Thanks so much.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.